This segment sponsored by Summit Physical Therapy. How we sit and how we stand is so important to keep a really strong posture. So today I'm really excited to have with me Andreas, who is the owner of Summit Physical Therapy here in Fort Wayne. Hi.
Good.
How are you?
Good. How are you?
I'm doing well, thank you. So this is such an important topic because I think most people think about how they sit because it can impact their future and how they slouch. Is that correct?
Correct. So as many things go wrong into our body, the same thing is true for posture. So it is kind of a cumulative process. So we all neglect posture from time to time, and I often say it's a little bit like a diet. We've all had fast food, but we don't go there for breakfast, lunch, and dinner. So if we sit right most of the time, then we can avoid all the downsides that come with poor posture. So poor posture essentially means you're not really engaging your core. You've kind of, we oftentimes call it hanging on ligaments. You're just kind of hanging on your spine. And when you do that, you're kind of overstretching connective tissues that, if you do this long enough, will be overstretched to a point where it might be hard to reverse that.
Yes.
So oftentimes we talk about, we use an analogy we call the cut knuckle analogy. The bent knuckle analogy. So it's kind of like you bend your knuckle back and you hold it maybe for 20 minutes. And after 20 minutes, your knuckle is probably going to be a little bit achy. So as soon as you start moving it again, it feels better. So what have we actually done? We've placed abnormal stress on otherwise normal tissue. But what if we do this not for 20 minutes, but we do it for 20 weeks, months, and years? So at some point, we no longer place abnormal stress on normal tissue. Now we place abnormal stress on abnormal tissue, which we're hopefully trying to avoid.
Yeah, and when people are wanting to keep a better posture, what are things that they can be mindful of as they sit and stand just to make sure that, okay, am I aligned correctly? Do you have any tips for us?
Yeah, so we try to make posture control as simple as possible. It's a little bit like a golf swing. I don't want you to have 10 thoughts in your head about posture.
Yeah.
So I think what has helped us the most is to get patients to experience the extreme of both. So the extreme of bad, sitting very slouched, then experience the extreme of sitting very erect, and then trying to find out, can I find some middle ground there? So in other words, not being fully flexed, not being fully erect, and when we spend time in that, what we call neutral zone, or we call it also neutral spine, then our core is actually engaged. And that's really the language we like to use, engage, because it really does not require a lot of strength. And sometimes people will cringe when I say core strength is overrated. What's underrated is core awareness, because it's actually been measured how much strength it takes to hold yourself upright, and it's about 20-25% of your actual core strength. So you would have to be extremely weak to not be able to hold yourself in that neutral position.
Yes, and that's interesting that you say that, because I think it's part of the mindfulness of, especially when you're working throughout the day on the computer or something, and you slowly start to slouch more.
Right.
So how would one be aware? Like, what are some signs or signals that the body gives you, because your body speaks to you, to say, hey, it's time to straighten up?
Yeah. Well, we actually encourage patients to maybe even set a timer and remind themselves until it really becomes a habit. So when people ask me, how often do you want me to do this slouch over correct drill? Then I kind of realize, yeah, maybe there's still a little bit of educating to do here, because we want you to do it all day long.
Yeah.
So I do it myself all day long. I do it when I drive to work. I think of sitting in my car, going to extreme of good, backing off a little bit, so I know I'm in this middle ground. And from a musculoskeletal standpoint, really what happens is that as we slouch, so this is the back of the spine, this is the front. As we slouch, we put a lot of pressure on the front of the intervertebral disc, and we just perpetually push it out the back door, so to speak. And so eventually the fibers in the disc weaken, and eventually that nucleus that sits inside the disc gets pushed out, and all of a sudden you find yourself straightening up or getting up from a chair, and you have to kind of walk your way up onto your hands, and you realize, ooh, my back's really stiff. So those are first signs that the disc is starting to displace.
Okay.
So by actually going to your slouch position and then back to your arch position and then settling somewhere in between, what you achieve by doing so is you really creating a nice even impact on the disc. And when you do that, you know, the disc stays much healthier, and also as we get older, you also keep even pressure on the vertebral body. So if you're in your 70s, 80s, and you've already been diagnosed with osteoporosis, that's where the compression fractures happen in the front of the vertebral body because you're constantly loading it in the front. So our goal is to load it evenly.
Okay, and so tell us about Summit Physical Therapy and the services that you offer for the community.
So speaking of, you know, on the subject of posture, it is almost always part of the rehab. So whether you're seeing a back patient, a neck patient, a shoulder patient, posture is always part of it. So we see primarily musculoskeletal patients.
Okay.
We have a pool that we're very proud to have with a treadmill, so we can bring people back to running maybe much sooner than what they would be able to do maybe otherwise. It's a nice progression to basically transition somebody from aquatic therapy to land therapy and then hopefully back to their sports.
Okay, so your facility is just really a place for anyone who is suffering from back pains, any
Right,
type of
right.
injury, they need recovery.
And so if patients are not really sure whether or not physical therapy is right for them, they can always call us and we will schedule them for a free screen and just let them know, yeah, this might be a little bit more than what we can do. Maybe you need to see an orthopedic surgeon, maybe you need to get some diagnostic workup, or yes, this is something we can work with. And that is a totally free service, so they can just call us, set it up, and we will give them our free opinion.
All right, well, thank you so much, Andreas, for talking with us. And as you heard it, if you have a pain or not sure what your final step is, the first step is to go to Summit Physical Therapy, and we will have the number listed below so that you can give them a call. We'll be right back. This segment sponsored by Summit Physical Therapy.